A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Allahumma salli ala Sayyidina Muhammadin wa ala alihi wa sahbihi sallim. I am Professor Dr. Ashfaq Ahmed, Associate Dean, Faculty of Allied Health Sciences, University of Lahore. I am also Head of the Department, University Institute of Physical Therapy. I also welcome in our panel team Dr. Asif Hanif Saab, Dr. Sayyid Asadullah Saab, or Dr. Fahad Tanveer. Once again, I feel honored to present our speaker, Professor Dr. Asif Hanif Saab. He has more than 14 years of experience of working as a researcher, academician, as well as he spent his whole time in supervising the students. He has done his PhD in biostatistics, as well as he has more than 200 publications. Luckily, we have Asif Hanif Saab on the board of University of Lahore, and this is the fourth webinar on the continuous series of different aspects of biostatistics. So once again, this is another important topic today, designing a research project. In fact, he was just discussing with me that today's topic is more oriented on discussion actually. So once again, I am thankful to Chairman Board of Governor of Afro-Asian Institute of Medical Sciences on behalf of University of Lahore, as well as being the moderator of this session. This webinar is, combined collaboration of University of Lahore and Al-Razi Institute, as well as Afro-Asian Institute of Medical Sciences. So I hope all the attendants and participants are learning through this, very informative lecture. So Professor Asif Hanif Saab, please carry on your lecture.
Thank you very much, Professor Ashfaq Saab, for your kind words and for motivating all of us to contribute in this noble cause. Okay, Bismillahirrahmanirrahim. Today's topic is designing a research project. Actually, I wish to discuss all the aspects with you people regarding do's and don'ts of designing a research project. When we talk about designing a research project, always it comes in mind that we are talking about a huge thing. We are talking about a big thing. But believe me, after when I was making the content of this presentation, and I also felt that this is a very huge and big thing we are going to discuss today. I will share my personal experience of more than 15 years of my research and education career regarding biostatistics and research methodology while teaching to postgraduate and undergraduate students at different levels. When we actually evaluate the research project mean here is not as much as big you are thinking in your mind, but research project mean the related to your academic research proposal. Dr. Sir, is the screen shared? Actually, I am feeling difficult to see.
Yes, sir, everything is fine. You may go ahead.
Okay, please. Okay, research project designing mean we have two different type of project related to a research. One is academic project proposal and the other is non-academic proposal that is usually made for funding. We have mostly involved in academic project proposal and academic project designing. So I will put more focus on academic project proposal, like I will discuss about synopsis at undergraduate, postgraduate, and even at PhD level, inshallah. The other component of research designing is non-academic. Non-academic mean we are actually involved in designing a project related to related to other fields, like we want to do operational research, we want to do action research, we want to do other research not related to our educational requirement. So I am supposed to talk about most of healthcare professionals in medical research doing their post-graduation, undergraduation, and even at I'm supposing there are a few research supervisors available, and if they are involved in designing the research project for their students, I will tell few things not to do and few things to be done while designing and writing the research project related to academics, like synopsis, like proposals. Okay, today I will put more focus on academic project or academic proposal that are synopsis for undergraduate, postgraduate, and PhD synopsis and proposals. This is just a glimpse so that you can think in your mind what we will talk today. While designing a research, there are two main things. One is conceptual design, other is technical design. Among the conceptual design, there are research objectives, there is research framework, there are research questions and conceptual models. There are few related and important definitions and operationalization of the things. And if you have attended my last webinar that was on an insight into research methodology, I have discussed in very much detail the component of research. But today we will put more focus on research proposal. I will not talk about the research methodology as such. We have already done in our second webinar. So always take in your mind that two components must be kept or must be outlined while writing your research synopsis. One was conceptual design that I told you, and other is technical design. In technical design, like research strategy, like research material, like research planning. And if I talk about the hierarchy of these things, what our students do, our students actually start from the technical design. They forget that there is another thing that is conceptual design. In my opinion and in my experience, where I get most of the students successful, for the students to be successful in very short period of time, and they can go to get approval of their synopsis if they think conceptual design in their mind at first. Students usually come with the research strategies, with the research material, with the research planning, but they forget to touch the conceptual design that is related to their research objective. In my recent past experience, a very senior person came to me, and he has a lot of questionnaire in his hand, and he requested me to help me in analyze my research project. I have lot of data. When I asked him what is your objective, he said, that's why I came to you. I asked him which kind of research framework you opted to collect this data. He said what it is. I asked him, what is your research question in your mind? He asked, what you talking about it? I never listened about these things. I actually collected the data, and I know once we collect the data, our research design is over. Now we need to analyze our data, then we will publish our research. So my dears, this is an example of many students. This is an example of many people working in different areas of research. So first of all, you have to be very careful about your conceptual design. So I wish you must have pen and notebook in your hand today to write few tips like research. While designing your research, conceptual design is very much important. And in this conceptual design, the one of the thing must be in your mind at first hand is your research question, is your conceptual model, the research framework, the research objective, how you will define your outcomes, how will you define your technical terms, how will you How will you evaluate the efficacy of the things? What do you mean by safety of your drugs? What do you mean by effectiveness of your treatment? For example, in many research synopses, the title is started from the effectiveness of treatment A and treatment B in management of, let's suppose, COVID patient. When we ask them, what do you mean by effectiveness? What do you mean by efficacy? What do you mean by safety profile of the drugs? They do not know. So first of all, you have to learn at the very initial stage. If you are making final your topic, if you are making final statement of your research design, what actually is in your mind about the effectiveness? For example, effectiveness is reduction in the signs and symptom of the disease. For example, effectiveness is reduction in the pain of patient with neck pain. For example, effectiveness is to make the patient able to come in the daily activities of life. For example, effectiveness means the reduction in the body temperature. For example, the effectiveness means to achieve the optimum outcome by introducing some strategies. And if we talk about the technical design, in technical design, research strategies, research material, research planning. Actually, our concepts are to start from the research planning. No, research planning is something different that will come later. We have to start from our research question, to ask yourself about the concept, about the concern of yourself, what actually you want to do, what actually you need to do, what actually you want to contribute in the existing knowledge. Once you start thinking like this, believe me, you will be able to design, execute, and get approval of your research proposal. How it works, how to work. For example, after doing all these things I discussed in the previous slide, you will start from the introduction. You will go for research aim and questions, your objective and the research questions. You will go for the literature review to find the gap related to your questions, objectives in your own discipline. You will study and design your project. Look, the study and designing project is not the first thing, it come later. Then you will see the timelines, you will make the outline of the things, and then you must think yourself about the expected outcome and impact of your selected variables, selected drugs, selected things to be done in your research. What we do, what our students do in daily practice, again, I am telling you, they start from the designing a project, studying the literature. Yes, studying the literature is very much important. If you have few research questions in your mind, first of all, outline your research question. After outlining your research questions, go to the literature. Go for the literature review. The literature review means the existing material, existing manuscripts, as existing articles related to your research question, not related to your discipline, not related to your topic, but related to your title, objective, and research question. Once you will go through the literature review, then you will see how it is easy to execute all the things. So what a research project has, the components of research project. The components of research project starts from the title, you everyone know. Actually, you have already made these things in your outlines, in your notes, in your mind. Now, once you have done all these things, then you will go for your title. You will go for few supporting letters, definitely. Once a person told me one of the hardest thing to complete the requirement to write the research project. For example, if you are designing a research project, think Is there any ethical issues involved? Are there any permission letters required? Is it easy to collect your data from the selected setting? Do you need any permission from the institutional review board and then from the institute from where you are planning to collect your data? Is it required? Is it mandatory? Yes, if it is mandatory, go for them first. Look, I have made it at second place. At this second place, if you have if you have made all the requirement that will you need later, actually we put this thing at last. When we put this thing at last, then we always get difficulty, when we always see and feel difficulty to execute our research idea. When you have done or planned or you arrange all these things, then you make a summary of your project. Summary of your project in your mind, in your notes. Usually this is not required by the institutes. Usually this is not required by the institute. But if you have summary in your mind, if you have summary in your pocket, if you have summary in your notes, then it will be easy for you to collect all these things. Then definitely start writing your introduction. How to write your introduction, I have already discussed in second webinar, but I will give some few tips other than those contents I told you in second webinar. Today we will consider that you are already familiar with the content, how to write introduction, but I will tell you which kind of mistakes we usually made, which kind of things we must take in our introduction. Then literature review may or may not be part of your research proposal, but it must be with you all the time until the publication of your research material, that is article, until the publication of your thesis, until the defense of your thesis. So this literature review must be with you. You must have very much grip on the existing literature. While I give you an example, once I was there to get the viva of a student of a postgraduate level. That student played very well in his viva. For example, he made each and everything and presented in very compact form. For example, his topic was about risk factor of cesarean section in a tertiary care hospital, and he searched the literature in very decent way. First of all, he told about epidemiology of cesarean section, in Pakistan, in Asia, and all over the globe. And he made very good table that was very much understandable. He told, for example, there are 7 studies in Pakistan, there are 20 studies in Asia, and there are 50 studies all around the world which were published in last 5 years regarding the prevalence of cesarean section. So believe me, he actually managed to show all the existing literature to the readers. So for successful research design, this kind of effort must be done by you as well. You must know the burden of the disease, the burden of the condition, the burden of cesarean section, for example. Then he gave very beautifully regarding the research risk factor about the cesarean section. As soon as someone see, he can understand this person has done a very beautiful job to explore the literature. So I request you people, first of all, ask your student about to have the components of the research topic. The disease must be known. Your student must know, or if the students are attending this webinar, dear students, you must know the burden of the disease in a chronological order. If someone asks you, what is the burden of this disease in Pakistan? Do not say this is not my topic. Never say this is not your topic. You have to answer about each and every aspect of your proposal, each and every aspect of your topic. So you must know what is the burden of your disease. Then the possible risk factor available in the literature. So when I was doing my PhD, I actually gave these things in a systematic way so everyone can understand about the topic, about the component, and about the existing literature. About my topic, I still have more than 1600 articles in my laptop. And then from those 1600 articles, few related articles on my tips. The examiner asked me about each and every aspect of my topic. So I request you people, you actually compose the existing literature in a way everyone can understand. Never give the gray literature, never give the raw literature, never give copy pasted material in your literature review. And many a times the examiner get irritated on the basis of your material you have given in your literature review. So literature review is very much important. Make it in a chronological order, in a sequence that everyone can understand. So it must be written in a story form. The easy tip for you people to keep in your mind, is your literature given in story form? Like someone read your literature review and he or she must get interest. What's the next? And when you give this kind of literature review or your literature review in this way, it will be easy for you to find the gap of the research. For example, you wanted to write about, let's suppose, dengue fever. Do you know when the first case of dengue fever published and from which country it published? If you know this, it means you have solved one component of your research. Then when it is called epidemic or pandemic, if you search for this, you have completed another component of your research. How many research have been done to explore the risk factors, to explore the treatment strategies, and what are the standardized diagnostic criteria of dengue fever? If you have done chronologically in 1998, this was happened 1999, this was happened in 2000, in 2004, in Pakistan, the first case was presented by this, then another 10 cases were presented, then 25 cases were presented, then a research paper published on the same topic included 700 cases. In first paper, the mean age was this. In second paper, the mean age was this. There were itne % male and female. There were actually the mortality rate in 2004 was this, 5 was this, 6 was this, 7. So this is the beautiful way, this is the good way to tell your reader your grip on your topic. Unfortunately, our PhD students even do not put more focus to know each and every aspect of the topic. So literature review is very much important to be understood and to present. Then objectives if there are more. Then hypothesis. Hypothesis means your research question. Then material and methods. Then questionnaires. Then references. Look, these components are major part of your research proposal. You cannot miss any of them. Yes, you should not miss any of them, but you can present in different way according to the requirement of your university, according to the requirement of your institute. If I say, do not review the literature because this is not in uniform requirement by your university or institute, believe me, you cannot complete your research proposal. If I say to you people, skip the summary or project, never read about the summary of your project, never bother the summary of your project, believe me, it will be lost for you people. You will not be able to understand these things in a way to be presented in good way. So these outlines must be with you in your mind, in your notes, in your pocket. And this is again the second thing, how you will present it at your institution level. If you miss any of the heading with you, it will not good for your research proposal, but you can present as the requirement of your institute. So title of synopsis or proposal, or the research project. The same slide I have given in the second webinar, the title must have ability to describe the things to be done. It must be self-explanatory. I will not explain much because I have already explained these things, but I will tell you what to do with the topic and what not to be done with the topic. Must be descriptive, novel, relevant to the researcher's field, feasible to do, and I told you the final criteria. Okay, I wish this must be in your mind, as I have already told. So what should not be done in your title? What should not be there in your title? Question mark. Never give your research question in your title. Many of the students make the mistake. For example, what are the risk factor of dengue fever? What are the clinical presentation of COVID-19 patients? Which treatment modality is appropriate to treat the gastroenteritis? So these are your research question, and it should not be your topic. It should not be your title. Many students give like this. Recently, I have seen the topic was same, the objective was same, the hypothesis was same. So it should not be same. Never give it in a question mark, never give in a research question. Never start your topic from the word to, because to explore the research risk factor of dengue fever is your objective, not your title. People usually write their topic as written in your objective, as written in your research question. No. Topic must be given in a simple sentence that must cover your, for example, area of interest, the thing you want to explore, and many people are agreed to at the place where you want to conduct the study. For example, what are the risk factor of dengue fever? For example, this is your research question. What should be the objective? To explore the risk factor of dengue fever. And what should be your topic? Risk factor of dengue fever in Punjab, in Pakistan, in Lahore, in area, for example, in defined area where you want to conduct this study. Now look, all three things are different. I am telling what is the topic. Risk factor of dengue fever in and around the city of Lahore. This is my topic. What should be the objective? To explore the risk factors of dengue fever. Now here it is your choice. You may or you may not give the setting. Research question. What are the risk factor of dengue fever in and around areas of Lahore? What will be your hypothesis? There is association, or okay, let me complete. There is association between dengue fever and the selected risk factor. What will be null hypothesis? There is no association between the selected risk factors and dengue fever. So all the things are different. Never copy paste these things in all these four areas. So what and how to write your title, I told you, and the title should not be written in a way I have already discussed. Writing your introduction, I have given very detailed comprehension about writing the introduction in your proposal in the previous webinar. So today I will tell what to do and what should not be done in your introduction. For example, give general introduction, magnitude of the problem, rationale of the study. These three components must be there in your introduction, and do not give too much literature review in your introduction. And once you write your introduction yourself, you have written last night, give a sufficient time to yourself to read your introduction again. For example, if you have written your introduction just right now, you must be very happy I have written my introduction. This is my tip to you people. Give at least gap of 6 to 8 hours. Then read your introduction again. Find the repetitions. Many students write your introduction and there are a lot of repetitions, should not be there. Research questions should not be there in your introduction. Many a time students have written their research question in introduction. Do not take material without reference. For example, the student has written that the prevalence of tuberculosis in Pakistan is 6.2%. And when we ask, from where you have written this? They said, oh, I forget from where I have taken. If you have forgotten to cite the material, do not write without reference. Search again, go to the search engine again. You can explore the history of search engine that was explored in recent past. Find the article and give the reference. While writing introduction, we usually make the plagiarism because our students do not know what is plagiarism. Plagiarism not only pasting the cut material. Plagiarism is not only pasting the material. Plagiarism means you are not citing the source. This is plagiarism. You have actually cited the wrong reference to a wrong percentage or concept. You have adopted a picture or radiograph. You have adopted a CT scan. You have adopted a performa. You have adopted a questionnaire in a snapshot, and you have forgotten to give the reference without paraphrasing your image, without changing the image. Usually we give the image by cropping, and this is plagiarism. Never give the image in which copyright is written. We actually are not allowed to give someone's image or material without his or her permission. This is actually the plagiarism. But we ignore this. We ignore this many a time. So never ignore this. Look, if you are reading introduction, and in first paragraph, the main article has given 6 references. What our student does, they take the material from same introduction, same paragraph, same references without reading the actual source. They cut the first paragraph. The main source has given reference number 1, reference number 2, reference number 3, reference number 4. 2 types of mistakes the student does here. The first type of mistake is removing the reference number 1, reference number 2, reference number 3, reference number 4, and giving the reference of main source from where he or she is reading. This is wrong. Because if the first line is written and the reference number 1 is given, this first line is not the article you are reading, but this first line is from the article he has cited. If you want to give the same line with the same reference, I request first you verify whether this author has written the exact theory, exact idea that he has cited. Many a time we see such kind of things are not there, but they have cited. If they have made the mistake, you are not allowed to repeat that mistake. So if you are copying the first paragraph from an article, you must verify these things from the given source, then give in your own word from the original source, not from this article. You can give reference of an article in front of you if you are taking material from his abstract, his conclusion, his results, not from the introduction. If you are giving or taking material from the introduction, see which source he has consulted. If he has given no reference in his introduction, then you can consider this is the concept of the main author you are reading. So literature review, I have explained and told in very much detail which components should be taken in your literature review in a chronicle order. I have given very much detail of objectives, but I will tell what to do, what not to do. So in objective do's, start with the word to explore, to find, to see, to assess. Always give in numbers if more than one objective is there. Never give the bullets. For example, students give bullets like ... No, give the number. Give your main objective first, then the related objectives later. So do not put question mark. Do not write large paragraphs. Do not give the long statements. Try to give the comprehensive statements in your objectives. For example, do not write like this. In this research, I want to explore the risk factor of dengue fever in area in and around area of Lahore situated in 5 kilometer in the diameter or the radius. So never like this, write like this. The simple way is to write to explore the risk factor of dengue fever. That's it. So never give in a question mark, what are the risk factor of dengue fever? Never give like this as well. So in operational definition, always give the operational definition in measurable form. How you will diagnose, how you will label, how you will assess the variables, how you will find the outcomes, how the efficacy will be given, how the safety will be measured. Like I told earlier when I was telling you to operationalize your things. So never give in dictionary definition, never give in a non-measurable technique. Like today I was discussing one of my students, he written his operational definition about the knowledge of some viral disease, and he written the knowledge of, look, the knowledge of this viral disease is very much important to be explored, so I have decided to know about the knowledge. No, this is not your operational definition. The operational definition is how you will measure. Then I asked him to write about the knowledge will be measured using a questionnaire adopted from, for example, Hanif et al. That was published in 2014 with reliability as more than 0.83%. This questionnaire contains 10 questions. The minimum and maximum possible score is 0 and 50. We will label poor knowledge if the score is less than 22. This is not your choice to write this. This is not you who are writing, but this is published. This thing is published, how to write your poor knowledge, how to label your poor knowledge. So in operational definition, always try to adopt the things that can be used to measure your outcome. For example, I'm giving you an example again, efficacy of the treatment. You can say the treatment will be labeled effective if there are 50% reduction in the symptoms. If patient has pain less than 3 after the treatment, if the fever is controlled. This is how you can write your efficacy. So already given a very detailed and comprehensive talk on observational study designs and experimental study design. In your research design, always choose any of them. What is new in today's webinar regarding this, if your objective is to find prevalence, to explore frequency of different characteristics, to explore frequency of different diseases, only choose, for example, case series, cross-sectional studies. If you want to compare, if your objective has written in a way to compare something, then choose case control in comparison study or analytical cross-sectional study. If you are giving a treatment and you want to see its response in future, give prospective study. If you want to take healthy population and to explore the impact of some risk factor in the generation of disease, choose cohort study. So I suppose you know everything about the study design, but I told you always choose your study design as per your objective. If your objective is to only find frequency of different characteristics, prevalence of different diseases, just to explore any phenomena, take case series or cross-sectional. If you want to compare among these, take analytical cross-sectional. If you want to compare your cases with controls, like in the studies of risk factors, always case control study to be done. If you want to explore case control for some specific disease, you must take case control studies. If you want to measure in future, if you want to take data from the past, you can choose retrospective or prospective. If you're comparing two treatment, for example, treatment A and treatment B in the treatment of disease A, treatment of disease B, you have to take quasi-experimental and randomized control trial. Already talked too much. We have already talked too much about the concept of these study designs. But today there are the tips when to take case control, when to take randomized control trial. Then how to calculate your sample size. Never think that the parent article has 30 sample size, I will also take 30. The parent article has sample size of 90, I will take also 90. No, the sample size must be calculated on existing literature related to your objectives. For example, you want to explore the prevalence of anemia in patients with tuberculosis. First of all, see how much patients are anemic in tuberculosis. Find the answer to your question from the literature first. That is called proportion. That is called percentage of your problem, magnitude of your problem. On the basis of this magnitude, you will actually calculate your sample size. The sample size is calculated on the basis of your magnitude, on the basis of your outcome, like the difference in pain after treatment, given treatment A and treatment B. After you gave treatment A and treatment B, what was the mean pain after 4 weeks in the literature? Use this mean pain after 4 weeks from the literature to calculate your sample size. Other components to calculate sample size is your margin of error, is your confidence level. That is mostly to be taken as 5% and 95% confidence level. And if you are testing the hypothesis, power of test must be there. Power of research must be there. That is usually taken as 80%. So I have already given the details of sampling techniques. If you're doing survey, if you have defined population, if you have defined population sample frame, if the people are sitting in front of you and you want to take sample from them, go for the simple random sampling. If you are taking every 5th, every 6th, every 9th, every 10th, go for systematic. If you want to compare your outcome, if you want to compare your phenomena, if you want to compare your frequencies, percentages in homogeneous population, for example, one thing in males, one thing in female. For example, you want to compare the diabetes mellitus among male and female. So you have to calculate your sample size separately for male and female. Then it is stratified sampling. You will use stratified sampling. If you are working, for example, knowledge, attitude, and practices of tuberculosis, knowledge and attitude and perception of tuberculosis among healthcare workers. Look, here healthcare workers are your consultant, your for example, manager, your PG, your nurses, the allied health, the allied health professionals, and the person who is involved in other stuff like cleaners, like compounders, like operation theater technologists. Here you want to compare the knowledge, attitude, and perception of tuberculosis. Here you are actually not comparing your outcome or the data in homogeneous population. For example, in consultant, there may be male and female. These are called the clusters. So take cluster sampling. And if you have ever wants to work on the rare disease, take snowball sampling. If you have already set the predefined proportions to be taken in your research, take quota sampling. If you want to take sample on the basis of your own convenient sampling. If you want to take the sample on the basis of the prerequisite criteria like inclusion and exclusion criteria, on the basis of your own knowledge, on the basis of your own purpose, then take purposive or judgmental sampling. Look, for surveys, take simple random sampling. When the population is defined and you have the sample frame, or the population is sitting in front of you and you want to take 20%, 30% of your population, take simple random sampling. You want to compare on the basis of homogeneous characteristics, take stratified sampling. You want to compare on the basis of heterogeneous population, take cluster. You want to take every 7th, every 9th on the basis of some previous system, take systematic sampling. If you want to take your rare diseases, take snowball sampling. If you want to take on the basis of predefined proportions, take quota sampling. Take purposive sampling if you want to take sample on the basis of your own purpose and judgment. If you want to take non-representative sampling on your own convenience, take convenient sampling. So write about the selection criteria, inclusion and exclusion criteria, then write your methodology in a decent way so everyone can understand about the steps of your data collection procedure. From where you will take the data, from where the permissions are already been solved, from where you will collect the blood sample, for example, where you will send the blood sample, how you will collect the efficacy or measure the efficacy of the treatment, how will you label the efficacy of the treatment, all these things must be in your methodology. Then choose the statistical analysis. Like I have already given you tips. If your data is quantitative, choose mean. If your data is categorical, choose percentage and frequencies. If you want to compare two means, choose independent sample t-test. If you want to compare paired observation, choose paired sample t-test. So all these things has already been discussed. Why I am telling you here? Because these are the core part of your material and methods while writing your research proposal. Give reference, appropriate references. Then one of the most important thing to give your questionnaire. We usually make very good research project, but we are failed to give an effective performer. What I mean by effective performer? A performer that can collect each and every possible information regarding your topic, regarding your objectives, regarding your hypothesis, regarding your research questions. For example, for good questionnaire, you need to make a structured performer. Mixture of open and closed questions. Always focus on asking question in a sequence. Like first give demography, then ask their contact details, then ask their social demographics, then disease history, then about the intervention you want to do, then outcome. Make a very decent table. Like, for example, you want to compare drug outcome of 2 drugs at 4 weeks. You can make it in a table, treatment A, treatment B. In the rows, baseline, 4 weeks, 8 weeks, 10 weeks. And in the column, later you can write your response. So this was all about the designing of a research project, do's and don'ts, tips from my own personal experience to you people. And I wish you will execute, you will use these things while writing your research proposal. And I'm sure I have conveyed you each and every possible aspect of designing and writing your research